What if I told you some medical tests after 60 can actually do more harm than good? Before you say yes to your next scan or screening, you need to hear what most doctors won't tell you. I need to tell you something that's been eating at me for years, and I know the moment I say it out loud, some of my colleagues are going to be pretty upset with me. But after more than 2 decades in medicine, after watching what happens to people when they follow every single recommendation that comes their way, I can't keep quiet anymore. I'm Dr. Ethan Parker, and here's the thing nobody wants to admit. Sometimes the worst thing you can do for your health is get too many tests, especially after you hit 60 or 65 years old. Now I can already hear some of you thinking, wait a minute, isn't this doctor supposed to be telling me to get checked for everything? Isn't prevention supposed to be the whole point? And yes, that's exactly what we've all been told. Catch it early, find it before it's a problem, stay on top of everything. That's the message we hear everywhere. But what if I told you that message is leaving out the most important part of the story, the part about what happens after you find something? Because here's what they don't mention in those commercials for health screenings. Once you find something, anything at all, even something that would never hurt you, the wheels start turning, and sometimes those wheels run right over your quality of life. So today, I'm going to walk you through 4 medical tests that I see causing more problems than they solve, particularly for people over 60. And I'm not doing this to scare you away from doctors. I'm doing this because I want you to understand what you're signing up for before you say yes to every test that gets offered. Now, before we get into the specific tests, I need you to understand something that changed the way I practice medicine. It's something called the Cascade effect. And once you see it, you can't unsee it. Here's how it works. You go in for a screening test. Let's say you feel perfectly fine. You're living your life, doing your thing. The test comes back and shows something. Maybe it's a spot. Maybe it's a shadow. Maybe it's a number that's a little bit off now that something might be completely harmless. It might have been sitting there for 20 years and would sit there for 20 more without ever bothering you. But here's the problem. The doctor sees it and now they have to do something about it, because what if they don't? And what if it turns out to be serious? So they send you to a specialist. The specialist orders another test, a more detailed one. That test maybe shows the same thing, still not clear. So now we're talking about a biopsy or a procedure, or maybe even surgery, and each one of those steps has risks: infection, bleeding, complications, anxiety, lost time. And here's the kicker. When you get to the end of all that, 9 times out of 10 you find out it was nothing. It was never going to hurt you. But now you've been through months of worry. You've had procedures, maybe you've had complications, and you're worse off than when you started, all because of a test you got when you felt fine. That's the cascade. And it starts with a single test that maybe you never needed in the first place. So let's talk about the first test that I see causing this problem over and over again. And this one's tricky because it sounds so smart, so modern, so preventive. I'm talking about whole body scans, full body MRIs or CT scans that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you from head to toe, catch anything before it becomes a problem. It sounds amazing, doesn't it? Like getting a complete picture of what's going on inside you. And I get it. I really do. The idea of knowing everything, of having control, that's incredibly appealing. But here's what happens in reality. Let's say you're 65 years old. You feel great. You're active. You've got no symptoms of anything. You decide to get one of these scans just to be safe. You go in, you lie down in the machine for 30 minutes, and a couple days later you get your results. And right there in the report, the radiologist mentions something. A small nodule in your lung, 3 millimeters, about the size of a pencil eraser, or maybe a cyst in your kidney, or a spot on your liver. The report says recommend follow-up imaging in 3 to 6 months. Now how do you feel in that moment? You went in feeling healthy, and you came out being told there's something in your body that needs watching. You probably can't think about anything else. Every time you take a deep breath, you wonder about that lung nodule. Every time you feel anything in your side, you think about that kidney cyst. So 3 months later, you go back for another scan. Maybe the thing is still there. Maybe it's a tiny bit bigger. Hard to say. The radiologist recommends seeing a specialist. The specialist wants to be thorough, so they recommend a biopsy. And a biopsy isn't nothing. It means putting you under anesthesia. It means sticking a needle into your lung or your kidney or wherever this thing is. It means risk of infection, risk of bleeding. And here's what the research shows. When they scan healthy people over 60, they find something unusual in almost everybody. I'm not exaggerating. We're talking 90–95% of people. Little spots, little cysts, little shadows. The medical term for these is incidental, things we found by incident. And the vast majority of them, the vast majority, will never cause a problem. They're just part of having a body that's been around for 6 or 7 decades. They're like wrinkles on the inside. But once we find them, we can't ignore them. And that's when the cascade starts. There's actually research on this. They followed people who got these whole body scans. And you know what they found? The people who got scanned didn't live any longer than people who didn't get scanned. They didn't avoid any diseases, but they did have significantly higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make them healthier, they made them sicker. So what should you do instead? And this is important, because I'm not saying don't pay attention to your health. I'm saying pay attention to the right things. Instead of getting a picture of your insides, focus on how your body actually works. Can you walk up 2 flights of stairs without getting winded? Can you get up from a chair without using your hands? How's your balance? How's your sleep? These functional measures tell us way more about your health than any scan. If you want a real health checkup, sit down with a doctor who will spend time with you, someone who will go through every medication you're taking, because I guarantee at least one of them is probably doing more harm than good. Someone who will talk to you about your diet, your activity level, your social connections, because those things, the boring everyday things, those are what actually determine how healthy you are. The scan is looking for problems that might not exist. The functional assessment is optimizing the health you already have. Big difference. Alright, let's move to the second test. And this one affects a lot of people because it touches on the fear we all have as we get older. I'm talking about getting a brain MRI for minor memory issues. Here's the scenario. Maybe you're in your mid-70s, and you've noticed that sometimes you can't remember the name of that actor you like, or you walk into a room and forget why you went in there. Normal stuff, the kind of thing that happens to everybody as they age. But maybe your kids are worried, maybe they've heard about Alzheimer's, and they're scared, so they push you to get a brain scan just to check. And I understand that fear. I really do. Nobody wants to think about losing their memory, losing themselves. But here's what I need you to understand. Getting a brain MRI for mild forgetfulness is almost never helpful, and it's often harmful. Because here's what happens. You get the MRI, and a few days later you're sitting with your doctor reading the report, and the report says things like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. These words sound terrifying. They sound like your brain is deteriorating. But here's the truth. Those findings are completely normal for someone in their 70s. They're describing what every brain looks like at that age. It's like doing a scan of your skin and being shocked that it shows wrinkles and age spots. Of course it does. That's what skin looks like at 75. The problem is those medical terms don't sound normal. They sound like disease. And suddenly you're walking around thinking you have brain damage, thinking Alzheimer's is right around the corner, even though you're fine. And here's the really frustrating part. Studies show that when you scan the brains of healthy people over 75, more than 90% of them have findings that look abnormal on the report. More than 90%. But most of those people have perfectly normal memory and thinking. The images don't match reality. I've seen people who are sharp as a tack reading books, managing their finances, doing crossword puzzles, and their MRI looks terrible. And I've seen people with early dementia whose MRI looks pretty normal. The picture doesn't tell us what we think it tells us. So what should you do instead? If you're worried about memory, there's a much better way to check. There are simple tests we can do right in the office. Tests that take 10 minutes. We ask you to remember 3 words. Draw a clock, count backwards from 100 by sevens. Simple stuff that actually measures how your brain is functioning, not just how it looks. And if those tests show a problem, then we start looking for causes. And here's the thing. Most causes of memory problems in older adults are reversible. Could be a medication making you foggy. Could be low vitamin B12. Could be depression, which often shows up as memory trouble in older folks. Could be sleep apnea, cutting off oxygen to your brain at night. Could be a thyroid problem. We check all of those things first. And you'd be amazed how often fixing one of them brings the memory right back. No MRI needed. We're looking at function, not pictures. We're treating the person, not the image. Now, if someone is getting progressively worse, If they're getting lost in familiar places, if they can't manage their money anymore, that's different. Then we need a full workup, including imaging. But for the everyday forgetfulness that comes with age, an MRI creates more problems than it solves. Alright, third test on my list. And this one surprises people because it seems so logical. I'm talking about stress tests for your heart, specifically putting someone on a treadmill just because they've hit a certain age. Here's the typical situation. Maybe you're 72 years old and you're going in for some routine surgery, nothing major, maybe a hernia repair or a knee replacement. And the hospital protocol says everyone over 70 needs a cardiac stress test before surgery. So even though you feel fine, even though you can walk a couple miles without any chest pain or shortness of breath, they put you on a treadmill. Now think about this for a second. If you can walk 2 miles in your daily life without any problems, what exactly is the treadmill test going to tell us that we don't already know? Your daily life is your stress test. You're already passing it every single day. But protocol is protocol. So you get on the treadmill, and here's where it gets problematic. Stress tests have a really high rate of false positives in older adults. That means the test says something's wrong when nothing's actually wrong. Could be because your heart rate doesn't go up like it used to. Could be because of medications you're on. Could be 100 different reasons that have nothing to do with a dangerous blockage. But once that test comes back abnormal, now you're on the medical conveyor belt. They schedule you for a cardiac catheterization. That's where they thread a tube through an artery all the way to your heart to look at the blood vessels. It's invasive, it has risks, and often they get in there and find exactly what you'd expect in a 72-year-old heart. Some plaque buildup, some narrowing, but nothing that needs stents or surgery, nothing that was about to cause a heart attack. But now you've been through an invasive procedure. And worse, you've been labeled as a heart patient. They put you on a bunch of new medications, and the psychological damage is done. Maybe you were playing tennis before, but now you're afraid to exert yourself. The test that was supposed to protect you has stolen your confidence and your activities. So what's the alternative? Listen to your body. That's the best stress test there is. If you can climb stairs, if you can walk at a good pace, if you can do your normal activities without chest pain or excessive shortness of breath, you're telling us your heart is doing okay. Those are the symptoms to watch for. Chest discomfort with exertion, unusual shortness of breath, dizziness. If you have those, yes, absolutely get checked. That's when a stress test makes sense. But if you want to know your future risk, there's a much better tool. It's called a coronary calcium score. It's a quick CT scan. Takes 5 minutes, no treadmill, no needles, very low radiation. It measures how much calcium, basically hardened cholesterol, is in your arteries. The result is a number. A 0 means very low risk of heart attack in the next several years. A high number means you need to get serious about prevention with diet, exercise, maybe medication. But here's the key difference. The calcium score tells us your risk. It guides prevention. It doesn't automatically send you down the road of invasive procedures. It gives you information so you can make choices, not anxiety that forces you into procedures. Don't let someone put you on a treadmill just because of your age. Trust what your body is already telling you every day. Now we get to the fourth test, and I know this one's going to be controversial. I'm talking about colonoscopies after age 75, specifically routine screening colonoscopies, when your previous ones have been normal and you don't have special risk factors. And let me be really clear here. I'm not against colonoscopies. They're a fantastic tool. I recommend them starting at age 45 or 50. They prevent colon cancer by letting us remove polyps before they turn into cancer. If you're in your 50s, 60s, early 70s and you're due for one, please get it done. But here's the thing. Every medical test is a balance between benefit and risk. And that balance changes as we get older. The benefit of a colonoscopy is preventing a cancer that if it develops takes 5 to 10 years to cause problems. But if you're 78 or 80 years old, is that benefit still worth the risks? Because colonoscopies do have risks, and those risks go up with age. There's the preparation, drinking that awful liquid that keeps you in the bathroom all night, which can leave an older person dehydrated and weak. There's the sedation, which in older adults carries more risk of confusion or breathing problems. And there's the big one that worries us doctors, perforation, a tear in the colon wall. As we age, the wall of the colon gets thinner. The risk of the scope accidentally tearing through it goes up, roughly doubles or triples after age 75. And a perforation is a surgical emergency. It often means emergency surgery, sometimes ending up with a colostomy bag. For an 80-year-old, that kind of operation can mean the end of independent living. Now weigh that against the benefit. You're trying to prevent a cancer that would take years to develop into a problem. If your life expectancy is less than 10 years, the math doesn't work out. You're more likely to be harmed by the colonoscopy than saved by it. That's why most medical guidelines now say to stop routine screening somewhere between 75 and 85. Now, this isn't a one-size-fits-all thing. If you have a family history of colon cancer, if you've had polyps before, if you have inflammatory bowel disease, that's a different calculation. But for the average person with no special risk, continuing to get colonoscopies every 5 or 10 years into your 80s is probably doing more harm than good. So what do you do instead? Do you just ignore your colon? Absolutely not. You shift from invasive screening to smart surveillance. First, pay attention to symptoms. This is crucial. If you notice persistent changes in your bowel habits, if you see blood in your stool, if you have unexplained abdominal pain or weight loss, if you develop anemia, those are red flags. At that point, age doesn't matter. You need a colonoscopy to figure out what's going on. Second, use the power of diet. This is huge. The single best thing you can do for your colon is eat fiber, fruits, vegetables, beans, whole grains. Fiber feeds the good bacteria in your gut, and those bacteria produce substances that protect against inflammation and cancer. Eating more lentils, more broccoli, more oatmeal, more apples, that's prevention that helps your entire body with zero risk. The message is get your colonoscopies when they make sense, up through your early 70s. After that, for most people, it's time to focus on watching for symptoms and eating the right foods. So there you have it, 4 tests that I see causing more harm than good, especially after age 60. Whole body scans that find problems that aren't problems. Brain MRIs for normal forgetfulness that create abnormal anxiety. Routine stress tests that trigger cascades of procedures. And colonoscopies after 75 that risk more than they prevent. You notice the pattern here? It's all about the cascade. One test leads to another, leads to another, leads to a procedure, leads to a complication, and somewhere along the way, we forget to ask the most important question, is this person actually better off? Because here's what I've learned in 22 years of medicine. Health isn't about having perfect test results. Health is about function. It's about being able to do the things you want to do. It's about enjoying your grandkids, taking walks, reading books, living your life without fear and without unnecessary medical interference. The goal at 65 or 70 or 80 isn't just to live longer. It's to live better, with independence, with dignity, with joy. And sometimes the best way to protect that is to say no to a test that's going to send you down a rabbit hole. You don't need to go down. Now, I'm not saying avoid all medical care. I'm saying be a smart patient. Ask questions. When a doctor recommends a test, ask why. Ask what happens if the test finds something. Ask what the risks are. Ask if there's an alternative. And then make a decision based on what matters to you. You're in charge of your health. Not the protocols, not the computer reminders, not the guidelines. And the more you understand about what you're agreeing to, the better decisions you can make. If this information was helpful to you, if it made you think differently about medical testing, do me a favor and share it with someone who might benefit from hearing it. And if you want more honest conversations about health and medicine, subscribe to this channel. I'm going to keep having these conversations because I think they matter. Let me know in the comments. Have you ever felt pushed into a medical test that didn't feel right to you? I read every comment and I learn from your experiences just like you learn from mine. Thanks for watching. Take care of yourselves and remember sometimes the healthiest thing you can do is nothing at all.